Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUAM News Extra. It's known as a silent disease because the majority of people who have it don't know they do until it's too late. We're talking about high blood pressure, which increases the risk of heart disease and stroke. 1/3 of people with high blood pressure don't know it. The only way to know for sure is to get regular checkups. This is even more true for those with a family history of high blood pressure. Here to tell us more about this condition that affects thousands of island residents is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in. Now, what exactly is high blood pressure and what's considered normal and high?
Yeah, so high blood pressure is the pressure within your arteries, and we measure that with the blood pressure cuff, and normal would be for an adult 120/80, and it naturally increases as we get older. Our blood pressure, when it's over 140/90, that's considered primary hypertension, high blood pressure. And then if you get up to 160/100, you're already in a secondary hypertension, much more dangerous category. So it's kind of like every 10 points you go up, you double your risk of heart and stroke. So it's really, really, really very important to control it. And your target goal is 120/80. Sometimes I compare this to kind of a garden hose. Okay, so when you're watering your plants with the garden hose, you want things to be just perfect, the right amount of pressure so that right amount of water comes out and everything is fine. And if you turn that pump up very high, and you've got sort of more like a fire hose going at your plants, there's going to be a lot of destruction. And that's what we can compare with high blood pressure, where there's so much pressure in that artery going, for example, to your brain, to your eyes, to your kidneys, to your heart, that it destroys those end organs over time or sometimes very suddenly, as in a heart attack. So that's an example, and when we take medication or make lifestyle changes to reduce your blood pressure, you're turning down that tap and you're, again, watering your plants in a much more healthy way.
Okay, so you want to keep it normal at a steady level, so to speak.
Steady level, that's right.
Okay, now are there certain symptoms to look out for high blood pressure?
Generally, like you said, it's a silent disease, silent killer. But sometimes people do have some warning signs. For example, headaches, that's a very common symptom, chest pain or palpitations, or sometimes just a feeling of heaviness in the chest. With the headaches, I notice that people tend to have them at the back of their head, sometimes at the front, but often just a feeling of pressure in their head. Those would be the main symptoms, if you have any.
Okay. Now, what are some risk factors? I was reading up that family history plays a huge role, as well as smoking, drinking.
Yes, and I think on island we have to look at obesity as our #1 risk factor for high blood pressure. So when there's much more body to feed with that imaginary garden hose, there's a lot more pressure that needs to be delivered. And so that's the reason why obese people will tend to have high blood pressure. Like you said, smoking also affects us because we get less oxygen when we smoke, and so our heart has to pump a lot harder, work a lot harder. Other risk factors that go along with high blood pressure are inactivity, no exercise, because again, you're not really working your circulation.
Okay. Now, high blood pressure gone untreated can lead to much more serious things. You were mentioning heart attack, as well as stroke.
Yeah, think about all the things that your blood feeds, starting with your brain, resulting in stroke, your eyes, resulting in blindness and visual problems, heart attack, or heart failure, pump failure actually, not even necessarily a heart attack. And then kidneys and dialysis, which is such a common problem that we have here on Guam. And sometimes people don't really get diagnosed until very late stages, as you said, so they'll be told that it's time for dialysis, and they think that the dialysis or that last step has been causing their high blood pressure, when all along they've had high blood pressure for years and years that's been destroying their kidneys, and the end result is they have no kidneys left and they have to get on dialysis.
So, you know, well, I'm a little under the weather now, but, you know, for the most part, I don't ever go to the doctor.
Correct.
So, and I know a lot of people who are like me, they just kind of go through their sicknesses. So how often should somebody check their blood pressure?
Yeah, I think you should really get it checked at least once a year. Maybe more often definitely more often if you have high blood pressure already. But you know, there are often wellness screenings on Guam, free checkups all over the place, or borrow a friend's blood pressure cuffs. You must know somebody with a blood pressure cuff, and they are accurate, the home blood pressure cuffs, and you can check it yourself. And just remember that magic number, 120/80, that's your goal. Anything higher than that, you're already in pre-hypertension. 140/90, you're already over the top, and you must get treatment. So often I see patients that are undertreated or sort of thinking that their blood pressure is okay when it's really not at our target goal. And they're needlessly walking around with a risk factor for death, really.
So, and speaking of that, how dangerous is it for somebody who's, you know, let's say I get my blood pressure check and they say, you're borderline high blood. And so they just kind of walk around and keep doing things. How dangerous that is.
It really is dangerous. And I try to emphasize that there are national guidelines that are really well established through studies, you know, and so 120/80 up to 140/90, you're in pre-hypertension, meaning you already have a risk factor, but you're not yet at the point where we would put you on drugs. We would encourage you to exercise and lose weight and eat less salt. Those are helpful things. But if you're sort of 140/90 and higher, you're no longer borderline. You really, really need treatment. And I think it's better to err on the side of caution and reduce your risk factor than walk around hoping that things will somehow get better on their own.
Yeah, and before we throw it a break real fast, what are some tips to lower your blood pressure? What are some easy ways, aside from, you know, watching what you eat, but also exercising like you mentioned?
Yeah, your salt intake will be very important. So locally we eat a lot of salty foods, especially in finadeni, soy sauce, all those kind of things. So reducing your salt intake, exercising every day, if you can, at least a 30-minute walk, cutting your weight, even just by 10% will make a huge difference to your high blood pressure. And then thinking good thoughts. Mental stress really makes a big difference too in how high our blood pressure is.
Because stress can play a huge role in actually
absolutely
increase. You could be a healthy person, but have a very stressful job, right?
Definitely. Studies show Monday mornings people have a much higher blood pressure than Friday afternoons.
I can see why. Well, we've got to take a quick time out, but there's more healthy living still to come. Stay with us.